Course. So I feel like our field is exploding. With glomerular diseases, we're getting like a lot of new treatment options for our patients. We've had so many newly FDA-approved medications last year, and starting this year, we have two new medications that got approved for glomerular diseases as well. For one of the medications that I'm going to talk about is going to be atrasentan that got FDA approval recently, and it's for the treatment of IgA nephropathy. So, IgA nephropathy is an autoimmune disease, meaning that your immune system attacks your own kidneys. And if we don't do any effective treatments for IgA nephropathy, about 50% of our patients they end up on dialysis or they need transplant in 10 to 20 years after getting diagnosed with IgA nephropathy. So, we've had a lot of new medications getting approved last year, and this year we got atrasentan getting the FDA approval. So, atrasentan data is from a clinical trial called Align, and they compared patients who were receiving atrasentan comparing to patients who were receiving placebo. And we noticed that about 38.1% reduction in urine protein to creatinine ratio comparing to patients who were receiving only placebo. And by placebo, meaning that these patients they were receiving ACE inhibitors and ARB before entering to the clinical trial. So we got the FDA approval for atrasentan. This is another option for our patients with IgA nephropathy, and that's great. As I say, always like for years and years, we didn't have a lot of options for our patients. We were just treating them with usual medications, off-label medications for their situations, and hoping for the best. But right now, when I'm diagnosing someone with a glomerular disease, I can actually discuss options with them. And that's amazing. Imagine you're diagnosing and then you feel like, okay, I have FDA approved medications that I can discuss with you, and hopefully I can prevent complications for you in the future. The other medication that got FDA approval recently is iptacopan. Iptacopan got the FDA approval for treatment of C3G. C3G is another autoimmune disease, and it's basically, again, your immune system is attacking your kidneys. And most of the times, our patients with C3G, they are dealing with more symptoms comparing to patients with IgA nephropathy. So, a typical patient in my clinic, when they come in with C3G, they might have swelling at that time. They have a lot of protein in their urine. They feel really tired. They are young, they want to work, but they feel so tired that they're not able to show up to work as well. So, iptacopan got the FDA approval for treatment of C3G, becoming the first medication that has the FDA approval for treatment of these patients. The data from iptacopan is coming from a clinical trial called APPEAR, and they compared patients with C3G who were receiving iptacopan comparing to patients who were on placebo. At month 6, patients who were receiving iptacopan, they had about 35.1% reduction in their urine protein to creatinine ratio comparing to patients who were receiving placebo. So this result was really significant, and that prompted the FDA approval for iptacopan. Sure, of course. I think the future is really bright for our patients and nephrology community. Nothing makes me happier when I hear like another new option for my patients. And as someone who sees patients with rare kidney diseases, it's always when they come to your clinic, they really want to hear about an option, like they are so disappointed sometimes. It's really hard to look it up online. I always tell them that, hypertension, everyone's talking about it, diabetes, everyone's talking about it. And you can always find like a family member, a friend, someone that you know that they are dealing with this kind of diseases. So it's easy to find a community, right? So to get the information from them. But for rare kidney diseases, for glomerular diseases, they come to our clinic and they're hoping to hear the news from us. They are hoping to find a way to find an option for them to prevent dialysis or transplant for them, or at least relieve their symptoms because a lot of them are dealing now with CKD symptoms. They are dealing with the proteinuria symptoms, which are swelling, fatigue, and most of these patients are usually on the younger side and they want to work, they want to build a family, and they're not ready to retire. They're not ready to go on disability. They're not ready to go on dialysis. So they are really hoping for having more options. I feel like for the future, we probably for the landscape of C3G, we're going to see another complement inhibitor for our patients becoming available. Based on the Valiant trial, we think that pixetacoplan showed really good, significant results in patients who were receiving pixetacoplan for treatment of C3G when it was compared to patients on placebo. For the landscape of IgA nephropathy, sorry, before I go to IgA nephropathy, for C3G, we have so many ongoing clinical trials on complement inhibitors as well, that they are on different stages, and we might see even more options in near future as well. For IgA nephropathy, probably the next medications that we're going to see becoming available for our patients are going to be B cell modulators, APRIL inhibitors, APRIL BAFF inhibitors, could be the next options for our patients that are going to become available. The clinical trial data from these medications were significant. They are sounding really promising. Both of these medications, they reduce proteinuria effectively, and that's a really good marker for us to show that we can hopefully preserve EGFR for our patients for a longer time. There are so many ongoing trials on IgA nephropathy. For B cell modulators, I think we have close to 10 ongoing clinical trials. And then complement inhibitors are emerging as a new possible treatment for these patients, as well as we have iptacopan as an FDA-approved medications for IgA nephropathy. And we have close to 9 ongoing trials for complement inhibitors. And there are so many other mechanisms of actions that for other medications and other ongoing clinical trials as well, that they are on kind of more kind of early stages, and hopefully in within the next few years we're going to see good results and significant results from these clinical trials, which can be translating into more options for our patients in near future.